Blurry vision after 60 is easy to explain away. You may tell yourself, my eyes are just tired. Or, I probably need stronger glasses. Or maybe you assume this is simply what happens when people get older, and sometimes that may be true. Your eyes may be dry. Your prescription may need updating. You may have spent too much time reading, driving at night, or looking at a screen, but after 60, blurry vision is not something to dismiss automatically, because your eyes do not work in isolation. They are connected to blood vessels, nerves, blood sugar, medication effects, inflammation, tear production, and the natural aging of the lens and retina. So the important question is not, does blurry vision always mean something serious? It does not. The better question is, what kind of blurry vision is this? And is my body trying to tell me something? That difference matters. Many people over 60 notice their vision changing slowly. Reading small prints becomes harder. Night driving feels more uncomfortable. Headlights seem brighter than they used to. Colors may look less sharp. The eyes may burn, water, or feel gritty by the end of the day, because these changes often happen gradually. It is tempting to treat them as normal aging, but common and normal are not always the same thing. A vision change can be common after 60 and still deserve attention. One of the biggest misconceptions is that blurry vision only means you need new glasses. Sometimes you do. A prescription change can absolutely make the world look clearer, but glasses cannot fix every reason vision becomes blurry. If the lens inside the eye is becoming cloudy, the problem may not be only the prescription. If the retina is being affected by age or blood sugar, stronger glasses may not solve it. If the surface of the eye is too dry, your vision may blur and clear throughout the day. If a medication is contributing to dryness or visual changes, the issue may be more complex than tired eyes. That is why blurry vision is better understood as a signal, not a diagnosis. One possible reason is cataracts. As we age, the clear lens inside the eye can slowly become cloudy. This can make vision look hazy, foggy, faded, or less sharp. Some people describe it as looking through a dirty window. Cataracts often develop gradually, so the change may sneak up on you. You may not notice it all at once. Instead, you may realize that night driving feels harder, glare bothers you more, or you need brighter light to read. Another possible reason involves the retina, especially the macula. The macula helps you see details in the center of your vision. It is what you use to read, recognize faces, drive, cook, and see fine details clearly. When age-related changes affect the macula, central vision may become blurry or distorted. Straight lines may look wavy. Faces may seem harder to recognize. You may still see the room around you, but the thing you are looking directly at may not look clear. That can be confusing, because the person may not feel like they are losing all vision, but the sharp central detail becomes harder to trust. Blurry vision can also be related to blood sugar. For people with diabetes or people at risk for diabetes, small blood vessels in the eye can be affected over time. In some cases, vision changes may happen before a person fully understands what is going on. This does not mean blurry vision automatically means diabetes. It does not. But blood sugar is one possible reason vision may change, especially if the blur comes and goes, or if someone already has diabetes or other risk factors. That is one reason regular eye exams are so important. Some eye conditions can develop quietly before they cause obvious symptoms. Then there is dry eye, which is very common after 60. Dry eye may sound minor, but it can make daily life uncomfortable. It can cause burning, stinging, redness, light sensitivity, watering, a gritty feeling, and blurry vision that changes throughout the day. One clue is that the blur may improve for a moment after blinking, then return again. Reading, screen time, dry air, wind, or long periods of concentration may make it worse. This type of blur can be frustrating because it is not always constant. One moment your vision seems acceptable. Later, the same page looks foggy. Medication effects can also play a role. Certain medications may contribute to dry eyes or vision symptoms in some people. These can include some allergy medicines, decongestants, antidepressants, anti-anxiety medicines, diuretics, and some blood pressure medications. That does not mean the medication is wrong for you, and it definitely does not mean you should stop taking it on your own. But if blurry vision or dry eye symptoms began after a medication change, it is worth asking your doctor, pharmacist, or eye care professional about it. Sometimes the safest step is not guessing. It is bringing the full picture to someone who can evaluate it properly. What matters most is the pattern. Did the blurry vision come on suddenly, or slowly over months? Is it in one eye, or both? Does it come and go? Does blinking help? Is there pain, redness, flashes of light, new floaters, or a dark shadow in the vision? Is it getting worse? These details matter because not all blurry vision is the same. A gradual change over time is different from sudden vision loss. Dryness that improves briefly with blinking is different from a new dark curtain or shadow. Trouble reading small print is different from sudden one-sided vision change with weakness, confusion, facial drooping, or trouble speaking. This is where calm attention becomes important. Sudden vision changes should be taken seriously. Blurry vision that appears quickly, affects one eye, comes with eye pain, new flashes, new floaters, a curtain-like shadow, severe headache, weakness, facial drooping, or trouble speaking should be treated as urgent. That is not said to frighten you. It is said because timing matters. For many other cases, the concern is less about emergency and more about not ignoring a pattern that keeps returning, worsening, or interfering with daily life. If you keep needing more light to read, if night driving becomes uncomfortable, if your glasses no longer seem to help, or if your vision is slowly becoming cloudier, those are good reasons to schedule an eye exam. And if you live with diabetes, high blood pressure, or a history of eye disease, it becomes even more important to stay consistent with professional eye care. There are also simple, safe habits that can support eye comfort and awareness. Regular comprehensive eye exams after 60 are one of the most important. They allow an eye care professional to look at the eye directly, not just guess based on symptoms. Managing diagnosed diabetes, blood pressure, and cholesterol with your healthcare provider can also support the health of blood vessels, including the small vessels in the eyes. Protecting your eyes from strong ultraviolet light with proper sunglasses may help reduce unnecessary stress on the eyes. If you read or use screens for long periods, taking breaks and blinking more often may help with dryness and strain. Staying hydrated, eating balanced meals, and avoiding smoking are also general health habits that support the body as a whole. But these are not cures for blurry vision. They are supportive habits. They do not replace an eye exam when a symptom is persistent, worsening, sudden, or concerning. The same caution applies to supplements. Many older adults see advertisements for eye vitamins or vision formulas. Some products may be appropriate for certain people under medical guidance, but supplements are not a universal answer to blurry vision. Blurry vision should not become a guessing game. Before adding supplements, especially if you take medications or have diabetes, high blood pressure, kidney disease, eye disease, or other medical conditions, it is safer to ask a qualified healthcare professional. Your eyes are not just cameras. They are living tissue. They depend on a clear lens, a healthy retina, good tear film, steady blood flow, nerve function, and overall health. That is why blurry vision after 60 deserves respect, not panic. Respect. It does not always mean something dangerous. It does not always mean permanent damage. And it does not mean you should assume the worst. But it does mean you should pay attention. If your vision is changing, do not simply keep increasing the font size and hoping it goes away. If your glasses no longer seem to help, do not assume the prescription is the only issue. If your vision changes suddenly, do not wait for days to see what happens. And if blurry vision is persistent, worsening, or affecting your daily life, bring it up with an eye care professional or a healthcare provider. The main lesson is simple. Blurry vision after 60 is not always just tired eyes. Sometimes it is dry eye. Sometimes it is cataracts. Sometimes it is the retina. Sometimes it may be linked to blood sugar, blood vessels, medication effects, or another health issue that needs review. The key is to notice the pattern: sudden, severe, painful, one-sided, or rapidly worsening vision changes deserve prompt medical attention. Gradual but persistent blurry vision deserves a proper eye exam, and everyday eye comfort deserves steady care, honest observation, and regular checkups. Your vision is part of your independence. It helps you read, drive, cook, walk safely, recognize the faces you love, and stay connected to the world around you. So after 60, protecting your eyes is not only about seeing clearly, it is about protecting confidence, safety, and quality of life. If this helped you understand one more signal your body may be sending after 60, subscribe for more calm, clear, and practical health explanations for older adults. And remember, this video is for education only. It does not replace medical advice, diagnosis, or treatment. If your vision changes suddenly, becomes severe, keeps getting worse, or worries you, please speak with a qualified healthcare professional or eye care specialist.